A heartbreaking diagnosis that we learned of yesterday for legendary music icon Celine Dion. Our loved by millions announced yesterday that she had been diagnosed with stiff person syndrome, an incurable neurological disease now causing her to postpone and cancel some of her planned shows.
I miss you so much. I miss seeing all of you. I always give 100% when I do my shows. But my condition is not allowing me to give you that right now.
Joining us right now is neurologist and director at the Johns Hopkins Stiff Person Syndrome Center, Dr. Scott Newsom. Doctor, good morning to you.
Good morning. Thank you for having me.
Thank you as well. You know, until yesterday, I think most of America had never heard of this. What are the symptoms of stiff person syndrome? Stiff person syndrome.
Sure. Yeah, I know it's a mouthful.
It is.
You know, it's an evolving spectrum of disorders, but the classic symptoms are intermittent spasms, rigidity, which can involve your torso, your legs more than arms. And the symptoms evolve over time. So most people will have this insidious symptoms within the musculoskeletal system. And then over time, they lose mobility. They can have significant traumatic falls. They can also have these unpredictable triggers that will cause spasms, like being out in cold weather,
right.
As simple as that. And what we've learned over the last, couple decades is people can also experience things like double vision, gait ataxia, wobbly gait, and a variety of other things.
Right, exactly. You know, she has had health problems for a while, but this apparently was not diagnosed until recently. How many people in the country actually are diagnosed with stiff person syndrome in an average year?
So we don't actually know that. And the reason being is because this is, I feel, an underdiagnosed condition. There's lack of awareness, but you and others are now, putting out awareness, which is, I think, going to be helpful. But the estimated prevalence across the globe is 1 in 2 in a million. But as I said, I feel that it's more common than that, and in part because of this expanding spectrum that we're seeing.
Absolutely. And so if anybody recognizes those particular symptoms, they should talk to their doctor. And you're talking about awareness. Obviously, more research funding is needed so that we know more stuff about it. But doctor, in the intro, I mentioned that some of her shows have been postponed and others canceled. She wants to come back. Will she be able to?
Yeah, it's hard to really comment on such a question. I can't speak to Celine's individual situation. I can say that from people I've seen over the years, there are some people that can get back to some semblance of normalcy, albeit, though, that does not take away the suffering that they may be experiencing on a day-to-day basis. However, I think with a multi-pronged approach to treatment, people can have an improved quality of life.
So it's all about managing the problem.
Correct. It's treating the symptoms, whether it's spasms, whether it's wobbly gait. But I will say at the core of this condition is the immune system going rogue, as I like to say. And so we try to tamper down the immune system, and that includes using medications that suppress the immune system or modulate the immune system.
Well, a lot of people have questions about it. That's why we asked you to come, and we thank you very much, Dr. Scott Newsom, director of the Stiff Person Syndrome Center at Johns Hopkins. Sir, thank you very much.